reminded, and that's why the importance of this discussion, that the agenda is still very relevant, that we are doing things, but we need to do more of it. And how can we do that is by generating support for implementation.
How did HIV/AIDS do so much better, so much more quickly?
Because it's a real life and death issue which touches men and women much more clearly. There was a more urgent political mobilization, and unfortunately, like many times, people think about one thing at a time.
Okay.
So they didn't think about the fact, or we were not able to put on the agenda, that 80% of HIV transmissions are sexually transmitted. 80%. Therefore, in fact, it's the Cairo agenda.
So is there a question on cooperation?
Into treatment. Let's treat. Let's get a technological fix. We give a pill those who are already infected, rather than thinking, oh, it's about sexuality. It's about power in relationships.
Okay.
And we have to do the more complicated work, but possible work. Yeah. So that's just a very short answer to a very important issue. The urgency, that's the other thing. We have very often a debate between the so-called population controllers, which is not a very nice term, and the so-called, let's say, choice, freedom of choice, the Cairo agenda, the more feminist agenda, the more human rights-based approach. These should not be opposites. We cannot afford to be divided. We all agree that these are important things. The goal is the same, that we have a better life for individuals, for families, for nations. And most likely we also agree on the means of how to get there. That is, for people to be able to do it themselves, to exercise a choice. They cannot be dictated what to do. In nothing.
Is it more effective? Is it more effective?
It is, in the end, more effective. You need patience. You cannot expect to have a change and turnaround immediately. But once you have given the means psychologically, mentally, and in physical ways, that is having access to services, having a contraceptive that fits your needs, men and women and young people will exercise that. They are rational human beings if they're supported in it, both by the immediate family and by the society.
Okay.
So I think we have the same urgency, the same cause, but sometimes the way we talk about it, and particularly the word control, is not appropriate, because ultimately, yes, we want to reduce the size of the population, but we want to do it in such a way as enable every person to exercise their rights, and that is an effective approach. Just
Briefly,
very quickly on partnerships, thank you very much for raising that. That's exactly UNFPA's approach. I'm only talking from UNFPA experience and telling you a little bit more about UNFPA, but I said partnerships are critical. So now if you go to this publication, which is out there, and this touches on the other issue of culture and human rights and working on, changing beliefs and attitudes and from within, this really gives you a good overview of that. How much is being done in a soft way, but effective way, but particularly working with everybody. So it goes with civil society organizations, UN system organizations, private sector, bilaterals, everybody. It's the only way.
Okay. Thanks very much. Wendy, you want to pick up on this? Thank you.
Well, thanks for the questions. That's very good to have this sort of dialogue. Let me continue, be provocative then. I mean, in many ways, I think I'm going to just spell it out, that I think that this concern about population has, for me, some very difficult implications. First of all, because I think that when we had those debates around Cairo's time, actually I remember having a debate here on environment, population. Oh, sorry.
Thank you.
We had a debate here at ISS on environment, population, and development, and the argument there was that we have enough wealth, and the problem is really consumption and environmental degradation of the north. So it was at that time, 15 years ago, actually I think it was 10 years ago, if I remember, but it was a decade ago, there was trying to seriously question, not say that it's always the problem of the very poor, they have to control, we don't want to use that word, they have to choose not to have children, they have to change their culture, they have to empower women to make those choices or whatever. It is also about our own, in the north, consumption and greed. Now that's very much a debate which environmentalists are aware of. And I think that, again, we need to start talking about that in relation to environmental crisis, financial crisis, and the real need to change our priorities so that we've got health systems which allow everybody to have access to good primary health care. You don't even have it in the US, but that's another debate. But you certainly need to understand that that's all about politics, about changing health systems, and about recognizing it's not about reducing numbers of people, it's about quality of life and well-being, but that also means reducing possibly a lot consumption in the richer parts of not only the north but also in the south. So it's a very complex political economic issue there that I really think Cairo tried to make sure it wasn't just seen as a demographic issue. And what worries me now is that when you say, but the real urgency and importance is really the numbers, for me it's not that, it's the real that is an indication of the
Can
concern.
I just jump in there, Wendy? Even from an economic point of view, surely having healthy people and healthy women and healthy children being involved in production and in politics, etc., is even economically more viable.
Oh,
so
yes.
I've never understood why the economic argument hasn't come on this one as well.
Yeah, well, I would agree. I would agree with you, but I think that's actually, if I could get to a couple of other interesting questions to link to that, which is a little bit. I heard the question, well, where is now the debate? I mean, why don't we have this sort of advocacy debate, the strong women's movement pushing for, where are the ideas, where is the change? And this is a little bit, to me, the concern, is that people, if I can say it, have got into a sort of fear mode that their own, this is my point of view, not necessarily what people agree, their own securities, their own livelihoods, they feel threatened by them. And in many ways are not being willing to go in and then try to make changes or think about other people. I mean, that I'm saying a lot very quickly. But in many ways, particularly in Europe, to me it links to this whole fear of the other, like the fear of there's too many people out there, we need to hold on to our own wealth, our own well-being, and there's a lack of engagement, if you like, in the international development debate as a result. Could I just say one more thing,
Yes,
Maladia?
yes.
Because I have to pick up on what Saskia was saying, which is, where is the new thinking? And I think that's a genuine question, because I don't know if Cairo was necessarily the new thinking, but it certainly brought in lots of people together who are excited and were trying to work through conventions and push forward, as we said, something that went very private, very public. It put on the agenda gender-based violence, all sorts of issues that were silenced. And Saskia mentioned one word now, heteronormativity, and Cairo was certainly within the heteronormative mode. But I think that those sorts of issues of differences also in relation to sexuality have got silenced and pushed down, which I think is part of again, this fear of change that we're going through with all this sense of crisis happening.
And maybe you can pick up the question about what about the alliance of the Catholic Church, the Islam, etc., who were very present, the opposition in Cairo. Have they maybe afterwards won?
I live in Italy, so I'm really, this is a serious issue. I mean, we're talking about, it's not about people who have a strong religious belief or who value faith. Nobody is talking about that. Everybody is entitled and to their own choices in that sense. What I'm talking about is the politics of the church and the politics of government. And certainly in Italy, you can see, if those of you who follow, how closely that is also linked.
You have to really speak into the microphone.
Am I speaking too fast?
Yeah,
or
no, into the
not into the microphone. Excuse me. So I'll eat it, she said. No, what I'm saying is that, first of all, I'm being very clear, this is not about faith and people's beliefs. So I want to make that clear, because there is, living in Italy, I'm very aware of the politics of the church and how closely, here we are, linked to the politics of a particular government.